Are you finding that you have high blood pressure and starting to worry you, which is making your blood pressure even higher? Maybe you're asking the question, what causes high blood pressure? My name is Dr. Taranella, and in this video, we're going to break down the mechanics of blood pressure and what the main inputs are for raising blood pressure so you can better understand what might be influencing your blood pressure. So if you like this kind of information on nutrition, health, hormones, genetics, and getting an expanded understanding of what's going on in your body and deeper awareness, click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's look at what causes high blood pressure. So in this video, we're going to look at what causes high blood pressure, and basically going to break it down in a simple way so you can understand what the overall controlling mechanisms are. That way you know how you can have an effect, positive or negative, on your blood pressure. So if we look at your system as a system of pipes, closed-end pipes, we can see that there's two main things that affect the overall pressure in that system. One is the overall volume of fluid that's in the tubes and the amount of tension in the pipes that hold that fluid. Those pipes are known as arteries, of course. And your body has various mechanisms to regulate the amount of fluid in the system and the amount of tension that's in those arteries. And this, of course, is how many medications work, by exploiting these different things that our bodies are naturally doing. And we can use that to our advantage to lower blood pressure and in some cases raise blood pressure. So when you have high blood pressure, it means some of the internal mechanisms of your body that regulate blood pressure are not working the way they should. So let's look a little bit deeper at what some of these mechanisms are controlling fluid and controlling the actual tension. So the fluid in the system is mainly regulated through your kidneys, and the kidneys do this by changing the concentration of salts, sodium and potassium, that's in your blood. Water follows sodium, so that higher sodium in the blood means higher fluid retention in your blood. This is why sometimes it's thought to help blood pressure by reducing sodium intake. And this sometimes does work, but most people are not salt sensitive. And since this is not the underlying reason most people have high blood pressure, it doesn't seem to work. Cortisol, the stress hormone, actually encourages more sodium retention and reabsorption of that sodium through the kidneys back into the blood. And this is one way that stress can actually increase your blood pressure. As far as tension in the overall system of those arteries, narrowing of the arteries or atherosclerosis, hardening of the arteries, is something that comes into play when we're thinking about the overall tension in that system. With the plaque buildup in the stiffening of those arteries, there's less ability of those arteries to expand when there's more fluid or when it's needed. This is thought to happen through a combination of things like high cholesterol, inflammation, high insulin, and other factors that are referred to collectively as endothelial dysfunction. The endothelium, if we look at an artery like this, would be that innermost part of the artery structure. That internal tissue responds to various inputs from both the local environment and also from systemic hormones that are floating through the blood. Problems with the endothelium is known as endothelial dysfunction, and that's thought to be the underlying cause for some people that have high blood pressure. Of course, high stress situations do produce cortisol, which can increase the fluid, but it also produces adrenaline and adrenaline-like molecules, which tend to constrict those arteries. That constriction and tension creates more pressure in the system, regardless of how much fluid is present. So what causes high blood pressure? Well, there are many causative factors involved with elevated blood pressure, but all those causative factors are going to influence these two things, either increased volume in the system for one reason or another, or decreased elasticity or hardening, stiffening of those arteries. So what do you think? Did this help you understand what causes high blood pressure? Maybe you want a little more detail on the causes of high blood pressure? Let me know in the comment section. I may do a separate video on those topics. I thank you for watching. We'll see you next time.